Hello and welcome. I'm Dr. Yasmine S, cardiologist and best-selling author, and this is my podcast, Positive Vibes on the Sunny Side. Each episode, my goal is to bring you uplifting stories and insights to inspire you to live your happiest, healthiest, most positive life. So thank you for joining me. Before we get into today's interview, I want to share some news that has a lot to do with the origins of positive vibes and is even related to my ORCHID model for positive living. That's O for optimism, R for resilience, C for creativity, H for health, I for integrity, and D for determination. Well, if you've listened to episode 1 of this podcast on the Waverly train disaster of 1978 and the origins of positive vibes, or even better, watched that episode on YouTube, and I'll link to that where you can watch it in the show notes, because that episode is one of my webinar episodes as well. Or if you've read my first book, Walk Through Fire, The Train Disaster That Changed America, you know of Frank Craver and his remarkable story, how he was the most severely burned survivor of the Waverly train disaster. Well, Frank passed away yesterday afternoon, having lived a full life into his mid-80s, 48 years longer than anyone thought he would, because this month marks the 48th anniversary of the train disaster where he nearly died. But he lived until yesterday afternoon, having overcome adversity after adversity with resilience and determination. And let me tell you, that R for resilience in ORCHID, well, Frank Craver had resilience in spades, and the determination that must go along with it. So today I'm sending my love to Susan Craver, his daughter, whose story is also in the book, and remembering Frank, his great love of life and his community, and feeling so incredibly fortunate to have known him. I am so very grateful for his having shared his amazing story with me. We were friends, and he will be missed. May he rest in peace. Today is a Positive Vibes episode, and that's PAW in positive, to celebrate our four-legged friends and family. Because, as you've heard me say before, what could be more positive than the pure joy our pets can bring us? So today I'm talking with Dr. Marc Smith, who is a veterinarian and the owner of Natchez Veterinary Services in Nashville, Tennessee. Marc has been practicing veterinary medicine for over 27 years, and I'm proud to say that he is my family's vet. And if you've been paying attention at all to the podcast or my Positive Vibes newsletter and e-magazine, you know how much I love my pets. So I will trust their care to only the best, and Marc is definitely that. He graduated from the University of Tennessee College of Veterinary Medicine, which is one of the best in the country, and he was voted Nashville's best veterinarian for the past 2 years in the Nashville Scene's Best of Nashville Readers Poll. Marc operates a holistic practice, which means that he practices both conventional veterinary medicine as well as integrative medicine, an approach that takes the well-being of the whole animal into consideration. And by the way, that's what holistic really means in human medicine, too, a whole approach, whole body, whole mind. As it says on his website, Dr. Marc Smith prioritizes your pet's well being through individualized and innovative medicine. Dr. Smith has successfully tackled the urgent challenges of standardization and excessive pharmaceutical use with scientifically proven methods. So, we're going to talk more about that in our interview. I also want to give a big shout out to Mark's clinic staff, Suzette, Megan, Willie, Kelsey, Christina, Julia, and Nick, who are just the nicest people and have been there for me and my pets through some tough times and some good times as well. I'll also link to Mark's website and social media accounts in the show notes, as always. And he is also the co-founder of Pet Tao Holistic Pet Products, and I'll have a link to that as well. So, Mark, welcome to Positive Vibes.
Thank you very much. I'm excited to be here. And as always, I want to spread the word about what we do. And I'm excited to answer all of your questions. Thank you very much.
Well, thank you for agreeing to be on the show and giving us some of your valuable time. I know how busy you are. So, first things first, what made you decide to become a vet?
Well, that's an interesting question. So I come from a family of lawyers, Lawyers, and I had absolutely no interest in doing that. So that's the first thing. Really, I think young people get into this, they have to kind of consider what they want to do. And so I remember when I was about 17, I came to this realization that I wanted to do something where I could be outside, number one. I like the outdoors. Number two, and I'll tell you how that fits in just a second. But number two, I wanted to do something where I could be a lifelong learner and kind of develop a craft. In some professions, the medical profession, it's harder to do that. It's easier to do that in veterinary medicine. And number three, I wanted to do something that assumed a lot of responsibility and had some, I guess, deeper seated importance to it. And so those were the three kind of underlying factors that made me go into veterinary medicine. And back to number one, where I could be outside, I started off my career doing mostly horse work, or predominantly horse work, probably 90%. And so I was able to be outside, uh, during that time. And that was the first 10 years of my practice. So those three things, obviously I loved animals, but I had some deeper underlying motivation to why I did it or
So,
made
I
that
want to,
choice.
yeah, that is so interesting. There's a lot to unpackage there. When you mentioned developing a craft, do you mean like a specialization, or tell me more about what you mean by that as it pertains to veterinary medicine?
Well, kind of like, you know, most vets, you get the foundational work academically, at a university, but I wanted to try to do something where, you know, I could develop my full skill set over time, and use it, I guess, as a way to reflect my personal values. And so I thought that would probably allow me to, be better than, everybody else. I mean, that was a motivating factor. I always wanted to be the best version of myself in my profession. And so I didn't just want to go to school and that's it. That's what I'm going to be, and that's what I'm going to do. I wanted something where I could constantly look forward to innovating and changing and being a better version of myself in my profession. That was important to me.
I really love that. And let's go to what you talked about, your first part of it being outdoors, because we'll talk about some of this again, because this is, I mean, that's really deep, actually, Mark. And I don't hear that from a lot of people in veterinary medicine or sometimes human medicine, really. So when you were working with horses, what was
Yeah.
that like? What was that like, and how'd you choose horses? Why not cows, for instance?
Yeah. Well, the area we're in had a good horse population. Middle Tennessee always has. And one of my first mentors was a horse vet. And so I was always interested in that style of practice, not only because I like the animals, but I kind of was drawn to just that kind of maybe not lifestyle, but that kind of way of practicing where you drove around to different people's houses or small farms or whatever. And I kind of like that. I lost a little bit of my motivation to do it as Nashville became more congested. So you'd sit in traffic more often than you'd be treating the animal.
Yeah.
So that kind of where I could be outside and do things instead of being stuck in a building, I guess, as a comparison. I just didn't envision myself sitting in a building all day working.
Right. And when you talk about that kind of veterinary practice, my mind automatically goes, and I bet a lot of listeners think this too, automatically goes to All Creatures Great and Small.
Yeah.
The
Yeah.
James Harriet books and now the show. Um, is it anything like that?
I would say yes and no. If you're doing strictly horse work, no. If you're doing all different kind of animals, yeah, it kind of has that. I don't want to say fairy tale, but it is, and I liked that. I liked that kind of reality at the time. But like I said, as Nashville became more congested and it's harder to get around, and actually less people have large animals now. I mean,
Yeah.
Middle Tennessee still a horse community, but it wasn't near like it was in the early 2000s when I started. And so I lost a little bit of interest, and then I didn't like sitting in traffic and that type of thing. So I
Oh
kind of
yeah, I don't like sitting in traffic either. I don't know anyone who does, so I can understand that. So, what range of animals do you see now?
well, that's a good question. I mean, I see whatever somebody will bring to the clinic, and occasionally I go out and still do horse work. So, I mean, I've tried to never turn people down for the most part. I mean, some animals I'm not very educated in and don't know a lot about. Pocket pets, guinea pigs, hamsters, iguanas, snakes. I don't know a lot about them. I'd see them if they wanted me to, but I don't know a lot. But I primarily see dogs and cats, and occasionally some other exotic animal, but primary 95% is dog and cat.
Yeah. Yeah. And how is that now? Because when I see you are in a building, so you are indoors. Are you still
Yeah,
getting some outdoor time at all?
I do. I do. I try to one day a week. I try to get outside and do something different. But
Yeah.
primarily, I'm indoors now, so I've changed in that aspect too a little bit. But that was a motivating factor. I don't know. Maybe it was I wanted more freedom or something.
Yeah.
But now I'm pretty much indoors most of the time.
And you had mentioned wanting to be the best version of yourself in your profession. I just really love that. And we're going to get to how you have innovated.
Yeah.
But you also mentioned personal values in there. And how do you think that comes into play with what you do?
Um, well, that's a good question. I try to be well, veterinary medicine has changed a lot. When I first started, it was, the local, small business, private business, that type of thing. And so, over the past, I don't know, 7 or 8 years, there's been this corporate influx of people coming into veterinary medicine. And so that's, increased prices, and changed kind of the landscape of what we knew as veterinary medicine, when I first started around 2000. And so I know that one thing that keeps me motivated and keeps me still pushing is that within our practice, I try to emphasize, or maybe not emphasize, but a lot of the things we do within the practice are motivated by some of my core values, like how you treat people. How do we empathize with people when they come in with a problem? How do we empathize with people when they don't have enough money to pay for a service or they don't want to? Just some of those things just deep in my core where I feel like, I treat people the way I want to be treated. And I try to, and that makes it very fulfilling for me.
Yeah. Yeah. And I know that one of the innovative things you have done is with your basic integrative approach to
Yeah.
veterinary medicine. So,
Hmm.
can you talk about what your approach is and how you came to it?
Yeah. So all dogs or cats don't do well on every type of medicine, just say a pharmaceutical. So what I did was, I, in alignment with me being the best version or best vet I can be, I thought I needed to become formally educated in some of these alternative treatments like acupuncture, like Eastern herbal medicine for pets, like chiropractic. I just needed to know those modalities, not through hearsay, but actually know them. And that way, if I didn't necessarily choose to include them in my practice, I at least could educate people on what I thought would provide value for them in their pets, whether I did it or not. And so I went back to school. Actually, I have a master's too in traditional Chinese medicine for pets. But I went back to school and learned those things. And so now, when people come into the practice, if they have a dog, let's say, that has arthritis and it can't take, a nonsteroidal because it throws up all the time or gets diarrhea, then I have other alternatives to offer those clients and pets. And before I didn't have that, and I've realized now that some people's aversion to traditional medicine, it can be grounded in some things that are pretty powerful. I mean, people can take a medicine they've been prescribed and it caused some real illness, and so I'm just aware of that and I'm empathetic to their hesitation. And I just provide a service where I think we can do some benefit to the pet. That's kind of how I came to those conclusions.
Yeah. And you mentioned on your website anyway about the challenges of standardization and excessive pharmaceutical use and
Yeah.
in veterinary medicine.
Right. So, if you think about it around here, and I'm talking about really Middle Tennessee, right? You go to the vet, and right out the door, you walk away with heartworm medicine. While it's important, it is important. You walk away with another medicine for fleas and ticks. It's important too. But I struggle a little bit with, the amount of just chemicals we're exposed to on a daily basis. I guess from the standpoint, because logically I have to think, even though science doesn't necessarily prove it out, that at some point that causes some harm in what we do, either to the pet or to the people. Now, I don't know that. I'm just saying logically, I have to think that long-term chemical exposure and the amount of stuff we give them can have some negative consequences. I know it is good, but you know, in other parts of the country where they don't have the same, flea and tick infestations and heartworm disease, are we still doing that? And my guess is probably yes. And deep down, logically, I just think it may be the best we have, but it may not be the best approach. And
Sure.
so I'm just cognizant and aware of those facts when it comes to, excessive pharmaceuticals. And every time a dog comes in, we give him an antibiotic for, his skin infection. Well, probably three-quarters of those probably don't even need an antibiotic. I mean, dogs are and cats are very resilient and they're great masters of their own health. You know what I'm saying? I mean, they're great at doing that. And so I'm just aware of those things and I try to minimize that. I'd say overall, I'm more of a minimalist in the way I do things.
Yeah. Yeah. And you and I have talked about that with my own pets. I'm a minimalist too.
Yeah.
And yeah, I think we share that philosophy. You know, some places you'll take your dog in and they want you to come in every 6 months or every year. But some places every 6 months, and they're doing the same tests and the same heartworm preventative, and even for adult dogs, giving them what is it called for worm elimination, the parasite treatments, and they're having them slurp down their parasite treatments,
Yeah.
even and I think that you only do that in puppies when it's needed, right?
Yeah. Yeah. I don't, yeah. I mean, I've tried to you know, uh, try to give the least amount of medicine to where I think it's beneficial to the pet and not extreme.
Right.
And because in school, this. I mean, you come in, you're taught give them something, give them some kind of something. And oftentimes in dogs and cats, it may not be needed and or necessary. And so
Yeah.
I've kind of adopted that, minimalist type mentality in the way I recommend treatments for pets.
The other is the teeth cleaning, and some
Yeah.
places will do it every single year.
Yeah.
Um,
And that's another one. I mean, you can always make an argument to clean a dog or cat teeth, right? They don't brush their teeth. So they're, even after you do a professional dental cleaning, you'll go back and see in 3 months, they'll start to build tartar. And so we encourage people to brush their teeth. Well, lots of times that's not practical. People forget, they don't want to, they can't do whatever. And so, I think it's insanity to put a dog under anesthesia every year to clean its teeth. Now, there are a few that may require that, but I'm talking about the average dog or cat. And so I struggle with that because, again, I think, there may not be scientific evidence of in episodes of anesthesia causing problems, but rationally and logically, I think how could it not cause some issue that maybe we can't document? And
yeah,
I'm talking more like a doctor when I say that, right? Or academically, but
yeah,
just practically, it just seems counterintuitive to me.
yeah, yeah.
So,
And I think most of us hate to see our dogs put anesthesia unless it's absolutely necessary because they come out of it and they're groggy and they're stumbling around. And, for some dogs, it lasts for a day or two. Same
yeah,
thing for people.
yeah,
Um, and, for some dogs, they have liver problems and the anesthesia, the medications we use for anesthesia go through the liver. And so it's not, it's not a safe, hands-off sort of thing. It's not a
yeah.
non-invasive process. So,
Right, right. It's thankfully dog anesthesia is pretty good, but there's always those, pets, you can screen them all you want to. They just have some things that make them more likely to have a bad recovery.
yeah,
And we see that not often, but we see it. So I'm real about, we recommend dental treatments. If there's pain, we recommend them when there's value to extend quality and length of life. If there's not, we kind of we don't encourage people to do them.
yeah. So now tell me more about the acupuncture. Do you do acupuncture in your practice?
Yes, we do acupuncture. I don't know, maybe 10 dogs a week we acupuncture. And most of those cases are most primarily they're going to be geriatric dogs with arthritis that are either intolerant of normal pharmaceuticals, or we use it adjunctively to help some of those dogs that still don't get around even on pharmaceuticals. We also use it for neurologic disease, primarily in the rear end, disc disease, degenerative myelopathy, just some nerve problems to try to stimulate the muscles and keep the nerves function as best we can. Those are the primary reasons we use it.
Yeah. Okay. And what kind of outcomes are you seeing with that?
I would say, as a general rule, I would say probably 70% of the pets do better with acupuncture. On the flip side, or on the same side, I would say that the owner satisfaction from doing that is probably higher than that. Um, you know, the medicines we have are pretty good for arthritis, right? Uh, but people uh, people appreciate every serious pet owners, I guess, they appreciate every little step we can take to try to alleviate uh, pain and discomfort and enhance quality of life. So we get very few times where people are unhappy with or feel like acupuncture's not been a good solution. And I try to recommend it. That's one thing that's a little, it's a little gray area about the way I practice because people will come in, they only want to, they want to acupuncture their dog, right? Well, in some instances, it's not the best way to handle the problem as it presents on that specific time period. I mean, if they
Right.
can come up there once a month, well, it's probably not going to be the best modality to use. If they have the time to come up there once every 7 to 14 days and want to invest that time in their pet, then it can be beneficial to them. I would say most dogs, maybe 90% of dogs, and I don't know what this is, but they may not, they perform better, they feel better, they have a little more twinkle in their eye when they go through the acupuncture. And I don't know what that is, but I feel like it just they're just better. I can't quantify it, but I just feel like they're better. I just do. And so yeah, we do quite a bit of acupuncture.
Yeah. Yeah. And I know and I like that you are a vet who takes a very careful and considered approach to the whole topic of spay neuter.
Yeah,
Whether or not to do it, and if you're doing it, how to do it, and when to do it. And, you're actually one of the few vets I know of, certainly one of the very few in our region, who
yeah,
offers ovary-sparing spay and vasectomy options for
yeah,
sterilization when it's needed.
yeah. So that's been kind of a so actually I learned this about 20 years ago from a human physician. And what I learned, we were having a conversation about something, and at the time I really didn't even think about it. And we were talking about prolotherapy, injection techniques into the knees of dogs in lieu of surgery, and so um, he was trying to tell me he did it because in veterinary medicine there was very few people doing it, and he made the comment that it's pretty predictable when women tear their cruciate ligament, and it's tied to the way their hormones fluctuate. Like the estrogen content and all that stuff. And I was thinking about my back of my mind. Well, most of my patients have no estrogen, so they all tear their ligaments,
Right.
in their knees. And then probably in about 2010, they started doing research on the effects of spay and neuter and age, and they found, I can't remember who did the research, but I think it was uh, you know uh, pretty accurate that a lot of these animals, they have some significant consequences. Not to mention the obvious, like they gain a lot of weight, but significant consequences in musculoskeletal growth and ligament tears and even vertebral disc disease, stuff like that, when you take that estrogen away, you know. So that kind of changed, kind of what I offered to people and how I look at doing it. So yeah, that's I've kind of followed some of the research in that from that aspect.
And you'll know this, so this is just for listeners. It was the very large golden retriever study, and positive vibes followers know that I have a golden retriever. It was
Yeah,
that study that shook the veterinary world, I think, several years ago. I think made it somewhat into consumer world too, when it revealed that Goldens who were intact, so not spayed or neutered,
yeah,
lived longer. They had fewer incidences of cancer and orthopedic issues, musculoskeletal, as you've mentioned, and more. I mean, so there was a big benefit to them
yeah,
for leaving them intact. And so there are a lot of strong opinions on this for understandable reasons, but yeah, I do want to talk to you about the science. And
yeah,
I think there's a difference between large breeds and small breed dog in the dog world, right?
yes. I mean, so um, the I mean, a small breed dog. I don't know if there's actually science behind this. Some of this is just me thinking this, but they get to their uh, you know, adult uh, height and weight faster than a large breed dog does. I think, or this is my personal opinion, they mature faster than a large breed dog does. And so I think there's more leniency in when you can alter or spay and neuter those dogs versus a big dog. Okay. That's one thing. The second thing is that there's less force on a small breed dog's joints than on a large breed dog, right? I mean, it's just physics. And so that's another reason why there's more latitude in when you can spay, large versus small. On the flip side, you know, I really believe that bigger dogs, function better over their lifetime the longer you can keep them intact. And that's just my personal observation.
Well,
It
and it's
could.
not just, I'm going to put in here, it's not just your personal observation. There are now studies, breed specific studies, and I do think they're all large breeds where they've put the data out there where you're absolutely right. And uh, I'm going to link to it. There is an article from the American Kennel Club. So listeners, you can go to the show notes and you will see this article, breed by breed, all of the ones that have been studied for this. At what age is it okay to spay or neuter? And some breeds you will find, and specifically, it may be a certain sex in that breed. For instance, female golden retrievers, you should always keep intact if you want to, maintain the advantage of longevity and, low cancer risk, etc. Some breeds, they haven't found as much of a difference. Some breeds, it's both sexes. It's really interesting. So I'm gonna put that out there for listeners to see. But Dr. Smith, I think you're way ahead of your time in because you have a good clinical judgment and you've been thinking about this a long time. But the science is catching up with you, so I think you could take some reassurance there.
Right. And I tell people when they're, thinking about it, what decision to make, because it's not a good decision for every different family, right? I
Sure.
mean, I tell them I think your dogs will be healthier if you leave them intact. You know, I think they will be healthier. There's always the risk of pyometra. That's the way I was taught. There's always the risk of mammary tumors. Actually, the percentage is not near what I was taught in school, but I think overall, if you take a population of large breed dogs, having them intact, they are healthier. They may not be as easy to handle around your home, which is a whole different thing, right? But they're healthier and they're more hardy and they're more resilient. That's what I think.
I have definitely seen that firsthand with my own dogs and with other people's dogs who have stayed intact, for sure.
And one other thing I want to say is that what happens in a dog when you take the ovaries out, not are you, you're suppressing the metabolic furnace that burns calories, but in a dog, what happens is, the adrenal glands, they produce some level of estrogen too. And what happens is the body tries to make up for that loss by laying fat down because fat can produce some level of estrogen too, you know. And so you've got where you've taken away the metabolic furnace, and then the body's trying to store fat to meet the needs that it should have, and that's why we have, uh, well, coupled with poor feeding practices, that's why we have what some experts say is an obesity epidemic in dogs. I mean, it's just their natural response to what we do to them. When we alter them. So there's really not an obesity epidemic just by itself. It's tied into the way we manage and handle our pets.
Yeah, absolutely. Yeah, and as we're talking about all this, I'm reminded about how veterinary medicine is practiced in other countries. And I know I've read in Europe, in some European countries, you're not supposed to spay or neuter an animal unless it's medically necessary.
Yeah.
Um,
So it's totally different than the way we do it here.
so is this are the methods that you use, are those taught in veterinary schools here, or did you have to learn that on your own?
Yes.
As a
No,
course.
no. I had to learn that on my own.
So why
Yeah.
isn't that taught in our vet schools?
Well, I mean, it could be now, I guess, a little bit. I would say no. And I would say that, you know, I'd say the focus it's probably like med school. The focus is not necessarily on prevention. It's more on problem based medicine. Somebody
Yeah.
comes in with a complaint. And so I would say that's it. Uh, you know, that may have changed some. I don't know. But we didn't get a lot on kind of the consequences of making some of those choices about how you manage your pets. We didn't get a lot on that. It was just spay them at 6 months and that type of thing. And the other thing that I want to say is that, uh, when there's a big, well, one of the consequences of spaying a pet at 6 months can be what's called urethral or estrogen urethral incontinence. And it's where they drip urine and the urethral sphincter, it responds to estrogen. Okay, so estrogen kind of drives how well that mechanism, that sphincter closes. And so we don't see a lot of it. I used to see it more when we used to spay dogs at 6 months, which has kind of been a standard forever. But it's pretty demoralizing when you spay your pet and all of a sudden at 12 months of age, it's leaking urine all over the place and you have to put them on a lifelong medicine, estrogen supplement medicine. And that has been a driver for some of this too, people seeking other alternatives because they've experienced that. And that's kind of where the empathy I have for people, it's more understanding
Yeah.
why they would be, why they wouldn't want to spay their pet at 6 months of age if they had one before where it dripped urine its whole life. I mean, that's demoralizing.
Yeah, of
So,
course.
yeah, so that's another reason why people commonly seek the ovary-sparing spay.
What about the male dogs now? What do you recommend for them?
Well, that's a tricky one. I mean, and some of that can depend on, male dogs when they tend to have probably more energy. They're more apt to run. They're more apt to mark in the house, and a lot of that's under the influence of testosterone. And so I still think, usually for a male dog, uh, if it's a small breed dog, I'll say to castrate them. Now, at what age? Some of that depends on that's individual with each person. For big dogs, lots of times I'll say, as long as they're not aggressive, if they're not, marking your whole house up, if they're not, doing humping everything in sight and all that stuff. Lots of times I'll tell them just to keep them intact. Now, if they want to do something because they don't want them to breed, or they don't want to be successful in breeding, then we'll vasectomize those dogs too. And,
Yeah.
I mean, again, I've had a couple of people who ended up wanting to castrate their dog after we'd done a vasectomy because they're more for behavioral reasons than anything else. When you castrate, typically a male dog will calm down. They may not say 20%, 15, 20%, something like that. Uh, you know, when people, you know, when their behavior becomes too rambunctious, they become hard to manage, hard to control. I have had a couple of people who went ahead and opted to castrate them. So I would say to most people, if the dog doesn't act bad, I just let him be intact. I mean, I wouldn't go through a surgery. But we do vasectomize some. We don't do that one as much, but we do some of those.
I've read that too about the success rate of male dogs who calming down, that it's about 20 to 30% after castration. In human medicine, if we had if we had an outcome with a success rate of only 20 to 30% for a
Yeah,
life-altering procedure that wasn't cancer, we, I don't think we would do that. So
yeah, yeah,
there,
yeah. So yeah, I mean, there's some stuff we do that may not, may not have good reason. It's kind of been done historically.
because it's been done, it's always been done that way. So what could you say to rescue organizations? Because I think they're in a more difficult situation than anybody, difficult
Yeah,
circumstances when
yeah.
and I think many
I,
of them still do spay neuter, but what do you say?
well, that's tricky because I think their goal is I mean, they want to have healthy animals, but they see the problem, the population problem, as as the main goal, I guess. And so that's a tricky one. It's a
Yeah,
hard one.
yeah.
Uh, and I guess that depends on the facts and figures of. I mean, now I hadn't researched this in years, but the last time I saw is that even with massive spay neuter, I'm not sure we had a real reduction in the animals in the shelters or that type of thing. I hadn't seen that in years, and that doesn't make sense to me either, as far as the numbers. But I would say, I mean, I guess they have to decide what their ultimate goal is, and if it is to reduce numbers, then you're going to spay and neuter them when they're younger. I mean, if the goal is the health of an individual dog, I think they're better off intact. That's me, you
Yeah.
know.
Yeah. So let's talk about cats for a moment.
Yeah,
What are the most common ailments you see in cats, and are any of them preventable?
yeah, and this will draw people won't like this, but I would say in cats the most common problems are going to be behavioral problems, and this is not in a specific order. Behavioral problems, feline cystitis.
That's
Um,
inflammation of the bladder. Yeah.
yes,
Yeah.
yes.
Mhm.
Um, and I mean, from a chronic disease standpoint, I'd say probably diabetes. I mean,
Mhm.
the thing that people have to remember is the first two, okay, behavior and uh, feline lower urinary tract disease. And basically, the behavior, I think a lot of cats, um, we get this idea of, they want to be inside and we need to protect them. And cats are just unbelievably resilient animals. I mean, they're incredibly resilient, and lots of times they need stimulation. They need outside stimulation. You know, and I think lots of times if you put a cat outside and this may not be for everybody's environment. Okay, so don't take it to the extreme. But if you allow a cat that freedom to be outside periodically, to follow birds or do, whatever they do normally, I think that eliminates a lot of the behavior problems we see in cats that are kept in the house all the time or in the apartment or wherever it is. The second thing is the cystitis. Cystitis, it's usually a non-infectious cystitis, so it's just inflammatory cystitis. We'll put them on antibiotics if we even think there's an infection, but a lot of cats get that from eating, foods that irritate the urinary tract, and they get them from stress. It's hard to tell, especially in multi-cat families. You can't tell when cats are stressed all the time. You may think they're not stressed because they're sleeping on the couch all the time, but lots of times there's power struggles between cats. You can have an outside neighborhood cat running around, and if it gets in the window of your house, that creates an intense amount of stress in the cat that's laying on your couch asleep. And that stress can lead to recurrent bouts of cystitis where they walk into the litter box, they squat to pee, one drop comes out, they turn around, they start meowing real loud, maybe some blood comes out, you run to the vet, that type of thing. So, cystitis and behavior problems in cats, I think, you know, they can be mitigated or even eliminated by them fulfilling their own stimulation. And lots of times, the best answer is to let them have some more freedom in an outdoor space.
That is so interesting. Yeah, thank
And
you.
people don't want to hear that because they hear of a hawk or a whatever it is coming down and swooping the cat off and carrying it 100 miles away. I mean, cats are resilient. I mean, you can make an argument, that cats, they don't need to go to the vet all the time. I mean, they're incredibly resilient animals, and uh, and I think most of them benefit from some uh, outdoor stimulation. And people don't like me for sometimes when I tell them that. I mean, they don't, because they look at it like we need to protect, 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 shield, shield, shield. I mean, cats are incredible animals. They're unbelievable.
They
And
really are.
uh,
Yeah.
and so I think they need more exposure to other things.
So you touched on this a little bit earlier, but let's talk about diet. And what is the role of diet in a pet's health and well-being?
Well, that's a good question. Most of our like commercially available, um, you know, foods that are kept in a bag are carbohydrate based, and they are packed with additives, preservative agents, stuff like that. And while it's pretty cheap or inexpensive, I guess would be a better term, it's readily available. It's not that method of feeding is not. I'm not going to say it's bad. I'm going to say it's not the best for health and longevity of your pet. They're designed to have protein-based diets and thrive off that. They can, keep their body fat under control. And so, but for some people, those type of diets, they're expensive. They're not applicable in every situation. So that's why we have to have some of these processed foods. But I think pets overall do better. Uh, they're healthier. They feel better. They live longer on a protein based diet. It doesn't matter if it's a dog or a cat.
There are many fresh food diets out there now available,
Yeah, yeah,
people keep in the freezer and can open up. They're maybe lightly cooked, they're human grade.
yeah. And those are more along the lines of protein based diets. I think those are better. And some of them are fortified with calcium and phosphorus. So if you just take a steak, virtually it's not going to have, or even a piece of chicken. If you did a nutrient analysis on it, you would find it has very little calcium, and probably zero phosphorus. And so what a balanced diet essentially means is that you've added some calcium to the diet, you've added some phosphorus to the diet in a reasonably balanced way to provide the right building blocks for that bone. You can do the same thing with a home cooked diet. It just takes a lot more work and effort. So for younger dogs, especially large breed dogs up to probably 16, 18 months of age, I recommend them feed a commercial or part of a commercial diet to their dogs so they meet their calcium and phosphorus requirements.
Gotcha. Okay. Okay. Very helpful. And you have a company, or you're co-founder of a company
Yeah,
called Pet Towel
yeah,
Holistic. Now, what is
yeah.
that?
Okay, so that's me and my friend and fellow colleague, Dr. Casey Dameron. We developed pet food that we formulated, and really that pet food it meets what it does is it takes the energetics of food according to Eastern principles, and it takes those energetics of food and it puts into a diet that meets Western nutritional standards. And so, one principle in Eastern medicine is, you know, and I don't want to get into too much of it because it's complicated, but the health of an animal is dependent upon external forces in the external environment. So, I mean, the easiest way to think about it is some foods energetically produce effects in your body. So, cucumber is cooling, and what that means is that if your body's is has an energetically warming uh, energetic to it, then you want to eat cooling foods to normalize you or bring you back into what they call balance. We've all seen the little yin yang theory, where it's
Yes.
floating balance all the time. So, another example may be, if you eat jalapenos, uh, in a lot of people, they get a tingling sensation in their lower bowel, and they may even have diarrhea from it, let's say. And so, in Eastern medicine, that's called draining. Draining, and draining can give you health benefits. Okay, and so. Um, what we've done basically in those products is taken the energetics of traditional Chinese veterinary medicine and put them in or combine them with Western nutritional standards. And
Really
so
interesting.
a lot of you may have, for instance, here's another one. A lot of you may have a dog at night that just starts panting, and you're like, well, I mean, it's 70 degrees in the house, and I don't know why my dog's panting,
I
right?
have that dog. Yeah.
And so lots of times in Eastern medicine, that's called yin deficiency, which means their heat, but it's not necessarily heat you can measure. It's an energetic term. And so that dog would be, it would be a candidate for what's called cooling foods. And cooling foods are foods that, according to the way they grow in the natural environment, they are have properties of cooling. Like cruciferous vegetables typically grow better when it's cool. Corn grows better at in 100-degree summer. So corn's a hot food or a warming food. Cruciferous vegetables like turnip greens, for example, grow better in cool weather. They're cooling. Does that make
Yeah,
sense?
it does. Yeah, that's really interesting.
So, like if you have a small child who's 8 years old, if you feed them a warming diet and they're hyperactive, the theory is that you need to feed them something cooling to balance them. If you give them warming foods, you're going to increase the hyperactivity because hyperactivity overall is, it's action, it's movement, it's heat, it's warm, that's the energetic. And so you want to feed them cooling foods to try to balance them out. Does that
I
make
have,
sense?
yes, and I have heard of elements of this in Ayurvedic medicine
Yeah,
that
yeah,
come it's rooted in India. This is,
Yes,
yeah.
absolutely. It's kind of they're similar. I don't know about a lot about Ayurvedic medicine, but I think there's some similar theories and stuff.
Similar principles to some of it.
Yes.
Yeah.
Yeah.
Well, Mark, you and I can talk all day, but because we love talking about animals and our pets, but I want to get to our last question. But before
Yeah.
that, yeah, before that, is there anything else that you'd like listeners to know?
I would say I think really that you know we got to keep in mind that our pets, you know, they're resilient. I mean, they're masters at taking care of themselves, and that we just need to keep that in mind, in the way we do things with them and the way we manage them. That lots of times they're very capable of keeping care of themselves. I mean, you want to do the preventive things that are necessary, but that lots of times our pets can take care of themselves, not necessarily because of what the vet does, but almost in spite of what the vet does.
Right.
Yeah.
Right. Well, all right, Mark, you know that the motto of Positive Vibes is keep on the sunny side. So,
Yes.
how do you keep on the sunny side?
So that's a great question. I keep on the sunny side by staying outside as much as I can, by getting plenty of exercise, and by always knowing that things could be a lot worse than they really are.
Isn't that the truth? Yeah.
Yep. That's how I stay on the sunny side.
Thank you so much. Thank you for being on the show, and it's just been such a pleasure to talk to you.
Yeah. Thank you for having me.
Thank you so much for listening to this episode of Positive Vibes on the Sunny Side. I hope you've enjoyed this episode, and I hope you'll stay tuned for the next episode of the Positive Vibes on the Sunny Side podcast, where I will be interviewing two authors, Leon Alligood and Kathy Bingham Turner, who have written a book called Boss Brooks, which is a true story that, trust me, will blow your mind. So stay tuned for the next episode when I will be interviewing those co authors. And if you would like to check out my online bookstore where you can get an autographed copy of my books. There are a few left of the Waverly Train Disaster book. That's Walk Through Fire, the train disaster that changed America. And this month marks the 48th anniversary, as you heard, of that event. And then there is also my novel, The View from the Cliffs, which is also available in paperback and ebook. And those are full color versions with designs by yours truly, as well as some photographs that are really beautiful in those books. So that's www.lastskywriting.com. That's my online bookstore. www.lastskywriting, writing.com, lastskywriting.com. Again, thank you so much for joining me. And until next time, remember to keep on the sunny side.